young man, and I said, "What have you gotten out of the program?" And he leaned in my face and he said, "I'm in the best physical condition of my life, sir." And I thought, now I can run me down and kick my ass even quicker. Offenders need to change their diet theory. That's a California one I came across. Right? This was one interesting. Treat them as babies and dress them in diapers theory. This woman, when they misbehave, she'd make them come to group in diapers. And she said, "Well, they're going to act like a baby. I'm going to treat them like a baby." It's a shaming technique. Right? What do you think? How many of you like to be shamed and humiliated? Anyone? So what do you think you get when you shame and humiliate antisocial people? You get angry antisocial people is what you get. This was a mental health program in Ohio. We couldn't figure out what they were doing with the kids. And finally they said, "We just want them to be happy." So we got happy offenders in that program. It's one of my favorites. I actually saw this years ago in New Jersey. But this one, male offenders need to get in touch with their feminine side theory. It goes something like this: the reason us men are aggressive brutes is we're not in touch with our feminine side. So they would make them dress up in drag and come to group in drag. So and you see, I think I'm making this stuff up. I'm not making it up. Here's some examples. Here's one out of California. Dance program gets juveniles moving on the right track. It says, there in a small, secure, concrete area, young male offenders dance their way toward a new outlook on life. Now the good news is they're dancing to rappers like Tupac, 50 Cent, and R. Kelly. So they got some role models cooking there as well. Here's one, drum circles. All right? She introduced the first drum circle in a New Zealand prison. She describes it as wow. That's the data they have. Wow. The staff was amazed because most clients continued drumming for 2 hours without stopping to smoke. It's a smoke cessation program. Now, you think, okay, well, they're using that with adults, but no, they're not. Here they are. They're doing it with kids. And, you know, you'd be surprised how many places I've gone and do this drum circle stuff. You would be surprised. Right? Here, I don't know what these two knuckleheads. They're meditating their way out of delinquent behavior. Here's one I like. Handwriting formation therapy aims to reform juveniles in Texas. So basically, it's a behavior mod on a neurological level, says this woman. When somebody is writing something, it's their brain writing. Okay? So she says here, handwriting formation therapy changes people's behaviors by training them to write in a different way. So if you fax her your delinquent's handwriting, she will tell you how to fix it. Right? She actually wrote me the other day. She must have heard about me somewhere. She wrote me and wanted to know that not only did her program work, it had 100% success rate. All right? So she can fix them all. We just got to track her down, all right, for that. It's based on the same theory as the drum circle thing. It's the horseshit theory, but they have. Here's a new one. Juvenile sentence to Shakespeare. That should fix it as well. All right. So that's my first lesson I learned. My second lesson is that if you want to reduce recidivism, focus on offenders that are most likely to recidivate. This, of course, is what we call the risk principle. Why would you target kids that have a very low chance of getting in trouble again? Right? How long are you going to get? Right? You know, I always tell people, it's a simple way to think about it. If half the kids that come out of your system never come back again, which half are you worried about? Well, you're worried about the half that will. Right? So here are the elements to the risk principle. Target youth with a higher probability of recidivism, provide most intensive treatment to higher risk youth, and intensive treatment for lower risk youth can actually increase their recidivism rate. If it wasn't for that last finding, we could just do everything with everybody. Throw them all in our most intensive programs, you know, and hope for the best. I mean, we may not be cost effective, but wouldn't do any harm. This is what a distribution of risk looks like, so you understand. I think you use the Yazzie. Most of you use the Yazzie here. That's a Virginia tool. So use the YASI, all right? But this is what we found in Ohio when we track kids using the tool that we have. Low risk means about 9% will recidivate. About 9%, 1 out of 10, a little less, will get in trouble again. That's what a low risk, when you get a low risk finding on a kid, that's basically what it means. Let me tell you, you're not going to get it much lower than that. Okay? You're not going to get it much lower than that. Moderate risk, about a third will fail. High risk, 60% or higher in some cases. Sometimes we can actually identify very high groups will fail. Now, if you're betting, you'd win here. I mean, you'd win more than you lose. Right? If you're betting here, you'd lose. Right? Because you got a 50% chance. You're going to lose more here than you win. Okay? Here's the first part of the principle. Target high risk youth. It's important, I think, for folks to understand that even with evidence-based practices, you're still going to have failures. And when you're targeting a higher risk group, you're still going to have a lot of failures. I don't want to oversell this work. And it's a little different for me than for you. I look at it aggregate. I look at the data. You look at the kids standing in front of you. And you want them all to be successful. You want them all to do well and not get into trouble again. Here's what the principle says. Here's the theory behind the principle. If you have 100 high-risk youth, about 60% will fail. That's what we found in Ohio when we assessed kids straight out. All right, they got arrested, they came to court, it was pretty serious, we assessed them. High-risk kids, when we followed them, about 60% fail. Okay? If you put them in a well-designed, evidence-based program for sufficient duration, you may reduce those failure rates to 40%. That's a significant reduction in recidivism. That's a third. You cut recidivism by a third. If you have 100 low-risk youth, about 10% will fail. If you put them in the same program, about 20% will fail. That's the risk principle. Now, here's the question. In the end, who had the lower recidivism rate? Not a rhetorical question. Who had the lower recidivism rate? Let's go back and look at the data. 40%, 20%. Even if you screw a bunch of them up, it's not going to be worse than the high-risk group. Okay? Here's the mistake we make. We compare high-risk kids to low-risk kids. Okay? That's the mistake we make. If you want to look for a treatment effect, you have to compare high to high, low to low. Not high to low. We do that all the time. You get a bunch of kids in your programs, you don't screen them, you bring them in. You got some low-risk kids, some high-risk kids. The high-risk kids are hard to work with, defiant, delinquent, families don't show up. Right? Then you got those low-risk kids, right? Easy to work with. We think we're helping them. Well, the data says otherwise. Right? The data says otherwise. Right? Second element of this principle, one that is relative. Probably when I was here before, I would have said to you about 100 hours of treatment. That's what you needed to get your effect. Okay? Most of the research in this area, right? The question is, provide most intensive intervention. What does that mean? Right? It's easy to say that. Give the higher risk kids more. What does that mean in practice? Most studies have looked at what? Time. How long you have a kid. Right? You ask me, I'll tell you, 3 to 9 months we get the strongest effects. Over 12 months, effects go down. Why do they go down? People give up. If I keep you in a program too long, you give up. Right? It's like a diet. How long are you going to do a diet? 2 years? Right? No. Most of us are going to do it for a while and it's hard. Right? So that's what I would have told you. The problem was that doesn't tell us anything about dosage. And I learned that lesson. I actually learned this lesson. I thought about it, forgot about it. I learned this lesson a few years ago. I was in Illinois, outside Chicago. I was looking at a juvenile probation unit. and they had a gang unit. They had a gang unit, and they had a program for gang